Hi, my name is Katie Williford, and I will be presenting my master's thesis, The Effects of Previous Amenorrhea on Vascular Function. The leading cause of death in America is cardiovascular disease. Males are more susceptible to developing cardiovascular disease compared to females until the ages of 65 to 70, when females begin to surpass males in cardiovascular risk. This is thought to be due to the loss of estrogen associated with menopause. Estrogen is beneficial for the cardiovascular health and aids in preserving endothelial function and arterial elasticity, while protecting the vasculature from oxidative stress and plaque development. Amenorrhea is when a premenopausal female loses her menstrual cycle for over 3 months. Amenorrhea may happen for various reasons, such as low body fat, disordered eating, stress, high levels of physical activity, and hormonal imbalances. Research has shown that women who are currently amenorrheic display endothelial dysfunction and arterial stiffness similar to postmenopausal females. However, it is unknown if this vascular dysfunction due to amenorrhea persists despite the regaining of a regular menstrual cycle. Many premenopausal females may become amenorrheic at some point in their life, so it is important to determine if there are long-term negative cardiovascular effects from amenorrhea. This may help in earlier intervention when a premenopausal female loses her menstrual cycle. Therefore, the purpose of this study was to determine whether females between the ages of 18 and 30 who previously experienced amenorrhea for a minimum of 6 months displayed impaired vascular function despite regaining a regular menstrual cycle for at least 6 months. 16 premenopausal females volunteered to be a part of the study. 10 were eumenorrheic, they had regular menstrual cycles, and 6 were previously amenorrheic for an average of 11.5 months at some point in their life and had regained their menstrual cycles for an average of 33 months. Participants were excluded for a history of cardiovascular, metabolic, and genetic diseases, pregnancy, and taking any medications that may alter cardiovascular function. Participants made one visit to the cardiovascular research lab at Appalachian State University within the first 7 days of starting their menstrual cycle. If you look at Figure 1, it shows the order of measurements that were conducted during the visit, such as Anthropometrics, Appalachian tonometry to measure central and peripheral blood pressures, as well as aortic stiffness, ultrasonography to assess arterial stiffness, flow-mediated dilation of the brachial artery to test endothelial function, and lastly, a DEXA scan. A one-way ANOVA was performed comparing the eumenorrheic and amenorrheic groups, and an ANCOVA was used to control for variance and confounding factors. Looking at Table 1 and Table 3, there were no significant differences found between groups in anthropometrics, endothelial function, and arterial stiffness measurements. The previously amenorrheic group had significantly higher physical activity and lower systolic blood pressure, mean arterial pressure, aortic systolic blood pressure, aortic diastolic blood pressure, and aortic mean arterial blood pressures. An ANCOVA was used to control for physical activity, and with that being controlled for, aortic systolic blood pressure and aortic mean arterial pressure remained significantly lower in the amenorrheic group. In conclusion, we found no significant differences in endothelial function, arterial and aortic stiffness between previous amenorrheic and eumenorrheic women. The previously amenorrheic group had significantly higher minutes of physical activity per week and lower in central and peripheral blood pressures. And after controlling for physical activity, aortic systolic blood pressure and aortic mean arterial pressure remained significantly lower in the previously amenorrheic group. This research suggests that previous amenorrhea may not have long-term negative effects on the vasculature after regaining a regular menstrual cycle. It also highlights physical activity having a positive contribution to optimizing blood pressures despite the loss of menses. Thank you.